Hello.
Hello.
Good morning.
Happy Friday.
Happy Friday. And where else would you rather be than the Gabba Cross River Rail Station? First of all, we can confirm that there is just one new case of COVID in Queensland overnight. A returned traveller identified in hotel quarantine. They transited through Doha. They were fully vaccinated. We discharged 5 patients in the last 24-hour period, meaning Queensland has just 7 active cases of COVID-19 right now. 83.62% of Queenslanders over 16, eligible Queenslanders, have now had their first vaccination, and 72.09% have had their second. And can I give a huge shout out to the community of Dumaji and the health workers there. They've had a fantastic result from their recent vaccination drive. 107 people were vaccinated yesterday and 82 people the day before. We're here at the Gabba Cross River Rail Station, and Cross River Rail is a massive project already transforming the entire southeast Queensland region, but its importance will only increase as we head towards hosting the 2032 Brisbane Olympic and Paralympic Games. Cross River Rail project was critical in us securing the Games. It was a key part of our bid, and of course this precinct here from the new Cross River Rail station through to the redeveloped Gabba will be the beating heart of the 2032 Olympic Games. So today we're announcing that next week a new interim land use plan will be effective for this precinct. Most of the planning for the priority development area here was done before we confirmed that Brisbane had the hosting rights to the Games and before we committed to that massive redevelopment of the Gabba. And so it's appropriate then that we put in place an interim land use plan that allows us to look at how the hosting of the Games as well as the stadium redevelopment will affect what can and should be developed here between now and 2032 and beyond. It will allow us to get that planning right and ensure that everything that we do between now and 2032 is all about ensuring we can deliver a fantastic Games for the world and transform our city, making it an even greater place to live. It will embed the commitments that we've made to ensure that there is public green space here as well as affordable housing so that people doing critical jobs in and around our city can also afford to live close to their work. I might ask Minister Bailey to say something more about Cross River Rail, and we have the Acting Chief Health Officer here who can also give a more detailed COVID update as well as answer your COVID related questions.
Thanks very much, Deputy Premier. Look, the Cross River Rail project will transform Brisbane and southeast Queensland, and of course the Olympic and Paralympic Games will also do the same thing. So it makes sense to integrate the planning of those two things together to ensure that the public benefit is maximised and that we have not just a great Games, but we have a great Gabba. This area has had public buildings and infrastructure on it for 150 years, but the public has never really actually had access to it. And for the first time, they will. They will have 50% open space in this area as part of this planning, and it makes sense that now we've secured the Olympic and Paralympic Games for Queensland, that we integrate the Cross River Rail project planning and station growth into our planning for the Games. It'll be a fantastic benefit for this community, and I look forward to having future announcements. The Cross River Rail project is going very well. Just south of here, the tunnel boring machine's going south, broke through 2 months early to the Bogga Road site, and we see the 2 tunnel boring machines going north, not very far off daylight, coming up onto the exhibition line, and that will happen by the end of this year. So that's a very exciting milestone to see that the tunnelling process is actually drawing to a close, and that the efforts will be concentrated then on the station developments, the signalling and all those sorts of things that go in the tunnels, given that the tunnelling process is nearly done. So we're very excited about that, and this is going to be a fantastic redevelopment as an urban hub and core here in the Gabba, right next to the world famous cricket ground, but also people coming on and off heavy rail on regular services.
Thank you, Deputy Premier. Thank you, Minister. As you've heard, only one new case today, which is wonderful news on a number of fronts. That case is overseas acquired, they're in hotel quarantine, not infectious on the flight and fully vaccinated, and we're working through with that case. They may yet be historical, which is even better news. Most importantly, that means there's been no new cases at Gold Coast and no new cases at Goondiwindi. So we're moving closer and closer to that 14 days full incubation period, which would be no case in that period. Would be wonderful news. No cases also in Doomadgee, despite lots of testing, and an enormous shout out and thanks to the Doomadgee community. 107 vaccinations yesterday, 82 the day before that, and 2/3 of those are first dose vaccinations. So enormous thanks to the Doomadgee community for coming forward and for the Northwest HHS staff for their work, as well as the Townsville Public Health Unit who look after that community. The other thing to note is the ongoing increase in vaccinations, and we're getting closer and closer to that 80% double vaccinated. There's a big weekend this weekend with the schools rollout, and just urge everyone, if you haven't been vaccinated already, please come forward, please get vaccinated. If you've had your first dose, come forward and get your second. If you haven't had your first dose, now's the time. Please get vaccinated. Thank you.
Sorry, Dr. Hickey, just quickly on Doomadgee, did the door-to-door vaccination only start after this latest outbreak of Robinson River?
Yeah, what's been happening in Doomadgee and a lot of the communities is we have been going out into the communities and offering vaccination. But with this outbreak, we've made a particular, well, the outbreak in Northern Territory, I should just clarify, we've made a particular effort to go out into the community and do door-to-door, and we're doing that increasingly in a number of the other First Nations and remote communities to make sure that everybody has access to vaccination, and it really is about bringing the vaccine to the people.
Door-to-door vaccinations work really well in Yarrabah and Cherbourg. Why is it not just a policy for all Indigenous communities to go door-to-door with the vaccine?
It's happening more and more, particularly as we've got better access to vaccine, and that's been a key factor. We're also making sure that vaccine is available in clinics in the Cape, as an example, so we can use that opportunistic vaccination. As people come for healthcare, they can get vaccination as well.
Dr. Oakley, would you say that school-aged children or younger are the most vulnerable when it comes to this influx of COVID-19 that's coming?
Look, vaccination for school-aged children hasn't come through into Australia yet, and ATAGI is looking at that. We're very, very hopeful of that coming through in January, and we're looking at what we can do to protect not just the children but the teachers that work in those schools to make sure everybody is safe.
Would that protecting the teachers mean mandating a vaccine for teachers?
That's something we're looking at the moment, and certainly something we're considering.
Dr. Hickey, could you just explain what's going to happen December 17 when the border opens? Is all of New South Wales still going to be a hotspot, or just Sydney? Like, if you're in Coolangatta, can you drive down and have lunch in Kingscliff without having to get a test?
Look, I'd like to think that we get the 80% double vaccination rate before December 17, would be the first part. But we're working through what that means at the moment to that cross-border community and the rest of the Queensland community as to how people can move across the Queensland-New South Wales border in that border zone, and particularly recognise that the majority of those people will be double vaccinated, but also making sure that those who are unvaccinated still have access to essential care, health care and other services.
So no decisions.
Your understanding of the rules is that if you're a cross-border commuter for work, for instance, you will need a
If you're travelling to Queensland to live in Queensland, you will need to be double vaccinated and you will need to have a negative test in the last 72 hours. And that's one of the things we're looking at the moment as we reach the 80%, is to the requirements for those people who live in that border zone and any requirements for testing. That's something we're looking at actively.
Exactly. The current status quo of your rules is if you're a worker coming into Queensland on December 17, $150 every 3 days.
That's coming forward to December 17. That's the thing we're looking at the moment. So we'll work through that and give you the extra detail, but we recognise that will be enormous challenges for people, for police, and it's a discussion we're having as to ensuring that double vaccinated people have greater access. But we'll tell you the details as we arrive at them.
There'll be some kind of subsidy.
Look, that's one of the options we're looking at. There may be no test, it may be free test. We don't know at the moment. We're talking to New South Wales, talking to other colleagues, and we'll let you know when there's a decision.
Are you still expecting to hit that 80% a week earlier than December 17?
Absolutely. On the current rates of vaccination, I think it should be well and truly well before December 17. And I just ask all Queenslanders, again, go and get vaccinated and bring that date forward.
What date is it looking at the moment?
It's a projection, so it could be anything between the 6th and the 12th of December, depending on how the vaccination rates go.
What is that projection for 90%? Do we have a date?
Early January is all we can say at this stage. It's much easier to project once we have the first vaccination dose, because then you can anticipate how long it takes people to be eligible for their second. So the sooner people go out and get that first dose, the sooner we can give you a projection for the second and the 90%.
So is it Premier? Just back to potential mandatory vaccinations for teachers. Children aren't vaccinated, the borders are opening soon. Are we leaving it too late?
No, I don't think so. And I think it's also have to remember that children haven't had the vaccination access yet, and that's something in January. But we want to make sure families enjoy life normally as much as we can, and this is just part of our journey back to normal life, hopefully.
Deputy Premier?
The Premier confirmed last week that the government was looking at extending the mandate for the entire public service. Where's that?
I think that continues to be under active consideration. Our focus now is the non-essential venue mandates and seeing how effective that is at driving our vaccination rates up. We'll continue to monitor that, and I'm sure there'll be more to say about that, Lydia, in the future.
How did the next one right yesterday with his comments around Queensland letting people do certain things? What's your response to that?
Well, first of all, I'm not surprised Peter Dutton's doing his best to not be seen to be undermining the Prime Minister, because I think behind the scenes he's doing his best to undermine the Prime Minister. I want to be careful not to give too much oxygen to the very dangerous views, I think, expressed by Scott Morrison, but let me make just a couple of observations. First of all, he made that statement yesterday where he criticised Queensland and specifically mentioned Brisbane in Sydney, where you have to be vaccinated to get a cup of coffee. So it's surprising that again, well, perhaps it's not surprising, that again he singles out Queensland while ignoring the fact that similar restrictions operate in his home city. The Prime Minister has always hated our efforts to save lives, but let's look at how effective they've been. Since June, more than 1,000 people, 1,025 people have died linked to that Sydney outbreak. And let's not forget the Prime Minister's responsibility for the start of that outbreak. In that same time, no people have died from COVID in Queensland. 0. And let me also just observe that the Prime Minister requires journalists to be vaccinated to attend his press conferences. Why should a barista in Brisbane be less safe at work than the Prime Minister at one of his press conferences at home in Sydney?
What do you make of the language used by Peter Dutton? He used phrases like segregation in terms of vaccinated and unvaccinated.
Well, this is about rewards. This is about saying to people who've gone and got vaccinated that they are rewarded for doing the right thing, rewarded for keeping themselves, their communities safe. And that reward is to not have to have restrictions when they go to non-essential venues like hospitality venues, because they know they can do so safely. Everyone else there will also be vaccinated. There, at different times, the Commonwealth Government have supported these kinds of mandates. Now, for whatever reason, they've decided in the last 24 hours to say otherwise, again trying to undermine our health response. They don't like the contrast. They don't like that in Queensland there is about as fewer COVID cases as anywhere else in the world, while in New South Wales, Victoria, the ACT and New Zealand, more than 1,000 people have died since June.
Will the mandate continue beyond the 90% double dose threshold?
The mandate will continue until when, that's yet to be determined, but the mandate, people should expect this mandate to continue well beyond the 17th of
Deputy
December.
Premier, why is it that there's a mandate for people that can't have a coffee, for instance? No one's taken away from your government that you have kept Queenslanders safe. Why is it that teachers aren't required to get the jab? We've always talked about the children being most vulnerable.
So there'll be plenty of time to consider the arrangements for return to school next year. The 17th of December is the last day of term for this year. And so given our current...
Earlier though, Deputy Premier.
It could be a week earlier, but you would not expect a massive outbreak in those few days, particularly given that we will be 80% vaccinated. You would expect teachers to be at least that level, if not greater. And so there'll be plenty of time between the end of term this year and return to school next year to look at what the vaccination rates amongst teachers are, what the risk is, and make determinations then.
Do you
all due respect, Deputy Premier, the former Chief Health Officer was saying that once those gates open, COVID's coming. 7 days is a long time for COVID to kick off here in Queensland.
I'm happy to have the Acting Chief Health Officer talk about what that period of time is likely to look like, but it's likely that it will only be a few days before the end of term that we start to see those COVID cases, and we'd expect to start to see seeding rather than widespread spread. That will take time, and that will likely occur in a period of time while school holidays are on, and we can assess what the risks are and consider what's appropriate for the return to school. We would expect that that teachers, as members of our community, will have a rate similar to, if not higher than, the average vaccination rate. So most teachers will already be vaccinated, and there'll be plenty of time to look at what the risks are related to those that
So
are.
is someone serving you coffee at less risk than a teacher?
I don't understand what you're trying to say.
To work in a cafe, you have to be jabbed, but to be around our children, you don't.
Well, the rules regarding non-essential venues are designed to keep patrons and staff safe and to reward those people who've gone and got vaccinated, and that's precisely what we're doing, making sure that those who've done the right thing, have got vaccinated, can start to go to those kinds of venues without any ongoing restrictions.
Do you think the vaccine should be mandated for MPs and their staff?
Well, I certainly think all MPs as community leaders should get vaccinated. I would expect their staff who have contact with people in the community to get vaccinated. I'd also expect that the restrictions related to cafes and bars and restaurants would apply to those kinds of venues within the parliamentary precinct. And so if there are MPs who want to continue to access the cafe, the restaurant, the bar at Parliament, they would need to be vaccinated.
Do you think WellCamp will be out of custody?
I do. I think we've got a range of uses for WellCamp. There will be an ongoing need for quarantine, but then there are also a range of other cohorts, students, people arriving unvaccinated, as well as there is a massive need for worker accommodation in Toowoomba and the southwest, Darling Downs in the southwest. And so I'm very confident that we'll be able to use that facility, and if we need additional quarantine capacity throughout next year, then it will be available to us for that purpose. The best time to have built a quarantine facility was probably 12 months ago, but the second best time is now, and we will have one ready by the end of the year.
I mean, PCR test, $150 for the PCR test, that adds up for families who want to come into Queensland. There'll be some kind of discount given to families beyond December 17th. I mean, that, if they can spend that money on airfares to come in, spend that money on businesses here.
Let me ask the acting chair to address that.
But what do you think, though?
Just as far as the costs for testing, look, people who are symptomatic are able to get tested, and that's covered under Medicare arrangements. For people who are getting tested where there's no symptoms, there are different arrangements in different states, and the Commonwealth and different pathology providers do determine some of those costs, and that's something that we have to work through with them, and the Commonwealth and pathology providers do set those costs themselves. It will differ.
Just on this story about a patient on the Gold Coast, she claimed she had to walk, she was dropped at a server, had to walk across the border to New South Wales because the taxi didn't want to cross the border. What do you know about that?
Look, I haven't got the specific details for that case as such, but what I can tell you from having worked in hospitals for many years is that we always have discharge arrangements for cases and their families, and having worked on the Gold Coast for many years as well, people returning to New South Wales is a very regular event, and those discharge plans are always made.
You have those plates. Yeah, how did she end up walking then?
Look, as I said, I don't have the specific details for that case.
Is that distressing though to hear that she had to endure that?
Look, I can't comment on that without knowing what the arrangements were. So,
Deputy Premier,
Can I ask you, just back on the border commuters and the test that they may require, with your personal view, because you're once helping set policy here about whether they should be paying $150 every 3 days just to go to work.
So my understanding that the reason they are charged for those tests is because they're not eligible for the Medicare rebate.
Sorry, I couldn't hear you. Sorry, I understand.
So my understanding, My understanding is that the reason those tests can't be provided free of charge is because Medicare requires that for a Medicare rebate, the tests need to be medically necessary. I'd urge the Commonwealth to consider that these tests are part of our wider health response and so therefore should be eligible for a Medicare rebate.
Why haven't we asked that already?
We have at different times. We have asked that. There have been times when we've urged people to get tested under circumstances that wouldn't normally meet the Medicare arrangements, and so we would urge the Commonwealth to consider that.
Do you think it's a bit ridiculous though that double vaccinated people coming from parts of New South Wales and Victoria where there's been no cases are required to return a negative test once the border opens?
No, I don't think anything in our plans here are ridiculous. They're all designed to keep Queenslanders safe, and they are all important measures. They will all play a role in controlling the arrival and spread of the virus here into Queensland.
Deputy Premier, would you think that it's crazy for a family of four to pay $600 in testing to come into Queensland? Surely this will go, I'll go to Byron, I'll go somewhere else.
Well, at the moment, it's very difficult for them to come into Queensland. So at that point in time, we will have much freer movement, and that's a good thing. That's a welcome thing. What we can do down the track to make that easier, we'll continue to look at.
So people are very sensitive to price. You are having $50 of holiday vouchers, $100 of holiday vouchers. Here you are charging people $150 a head. Do you recognise the price signal there?
Well, let's also recognise that this is a really important step. This is a really significant easing of restrictions. Right now, those people have to fly here, which is also very expensive. So these arrangements are in place to keep Queenslanders safe. We make no apologies for that. We would urge the Commonwealth to consider whether Medicare rebates should be provided for tests that may not be medically necessary but are part of our health response.
So you think $150 is too much to pay for a family? I think that's too expensive.
Well, at the moment, it's very difficult to come to Queensland, and at the 17th of December, maybe a few days before, it will be much easier for people to come here. This is a very significant...
Right? You wouldn't agree it's affordable for people?
Well, it's important that people are vaccinated and we know their COVID status. And that's what those arrangements are for. Arrangements regarding rebates for tests in New South Wales or another state, they're a matter for that state and for the Commonwealth
As the
government.
Marlena's trying to get to the point of $600 is a deal breaker for most families, right?
Well, not necessarily, but the arrangements that we've put in place are all about keeping Queenslanders safe, and we make no apologies for that. The fact is that being vaccinated and having a negative test will assist us to control the arrival of the virus into Queensland.
Deputy Premier, how much discussion has actually been around this PCR test? It seems that something on your tip of your tongue you want to say it's going to change, or well, we just don't seem to know what's going on with this testing. Like post the gates opening, $600 is a lot of money to a family that wants to come.
We've been very clear that at that 80% mark, people can begin to come here again. Our borders will be open again, but they need to be vaccinated and they need to have a negative test.
Do you think it would deter people from coming here?
It'll be a consideration, but but people are coming from places with very high levels of the virus, places where more than 1,000 people have died since June. We've had nobody die since June here in Queensland, and only 7 people throughout the entire pandemic. And so this idea that you might have heard from the Prime Minister and others that at some point in time the whole thing's over, well, it's not over in New South Wales. It's not over in Victoria. People continue to get the virus. People are continuing to die. And so we will continue to need health measures, including for people coming from those places.
A quick question for the At what point, with the flu, for example, not everybody goes and gets tested for the flu every time they have symptoms. At what point with COVID do you no longer go and get a COVID test? Is it in 2 years, 3 years?
Look, I think that's a question of the future, and COVID, we will move to a stage where we're living with COVID, and as that occurs, we'll treat COVID the same as any other endemic disease, and that's based on a risk premise as how likely COVID is, how likely flu is, but we're not there yet, and we've got to get through this stage through till this next winter probably, but COVID will become an endemic disease.
Do you see any situation in Queensland where international travel will resume before 90%?
No, look, our roadmap at the moment is that international arrivals at 90% will not need quarantine At 80%, they'll be able to go into home quarantine under the existing arrangements and making sure that environment is suitable.
The roadmap actually says reviewed at 90.
So we'll review that. Obviously, that's dependent also, and I think we've said this before, on the number of cases in our Queensland community. And that's a really big determinant. We're seeing internationally big surges in cases. Germany is an example, 67% double vaccinated, but they've had enormous numbers of cases come through, and it just emphasises the need that the more vaccinated our Queensland community is, the more we can restore those actions and international arrivals as part of that.
Doctor, in your medical opinion, when do we start just living with this as best we can? When do we draw the line and say there's going to be cases, there's going to be people hospitalised, we have to get on with our lives?
Look, we're doing that increasingly now, but really the big determinant, we keep saying this, is the higher our vaccination rate in Queensland, the better we can get on and live with COVID as a normal disease, because we can manage the load it puts in our community. We know in a vaccinated community, people are less likely to get sick, less likely to need hospitalisation, less likely to die, and that is just so important for Queensland.
Dr. Could you just talk through the, health advice, why people coming from communities that have no cases and are double vaccinated need to return tests once the border opens?
Look, at the moment we work on a hotspot environment, and New South Wales and Victoria both have cases. In Victoria in particular, it's still approximately 1,000 cases a day, and that's important. That it's difficult to differentiate to the individual. It makes it very, very difficult for police on the borders to drill down to that individual detail. So it does make it harder for individuals, and we recognise that, but it is about keeping Queensland safe. If it means someone has to get a test to come into Queensland and we stop an outbreak that costs thousands of dollars for our community, millions of dollars for our community, and Queenslanders get sick, look, that's a small price to
How do
pay.
we define a hotspot in Queensland?
So that's differentiated at a national level as well, and we work through the caseloads that are occurring in the different jurisdictions. So Northern Territory is currently Katherine and Robinson River, but that's an agreement based on the lockdown requirements in Northern Territory.
Dave, what did you make of the Prime Minister's comments yesterday about the mandating now? Do you think that was damaging in terms of
No, look,
trying to encourage people to get
I'm not going to comment on the Prime Minister's comments, but what I would say is that I just have to look at the way Queensland has managed COVID, and the fact that we're here with 7 active cases of COVID, approaching 80% double vaccinated. We've had 21 days of lockdown in the Brisbane community. We look at Victoria that has the longest lockdown internationally, and we are in such a good place.
Doctor, can I ask about the COVID checking up? Because someone's said to me that you can now upload your vaccine status.
Yeah.
And they did so. And then when their app updated on Wednesday, it locked them out and requires all of their checking history. So their checking history starts on Wednesday. Have you been hearing about these sorts of problems?
I haven't heard that specific problem. What I have heard is there's been significant upsurge even today with people uploading their vaccine details into the check-in app. And I think it will make things much, much easier as we start to use that at 80% for people to come through, use the check-in app and have their vaccination status confirmed.
Minister Bailey, I know you're chomping at the bit to get involved here. Can we go back to Cross River Rail? We need to get another yarn in the newsroom.
Sure. Sure, Peter. Happy to do that. Yeah.
Can we go from the top again?
Yeah, look, the Cross River Rail project here will transform the Gabba, and this is going to be a really important part of the Olympic and Paralympic Games, to have heavy rail arriving here every few minutes with 900 passengers at a time pouring into the stadium. This will be a whole concourse of open space, restaurants, cafes, a core to the community here in the Gabba. So we want not just a great Games, we want a great Gabba as well. And with the Cross River Rail project, we've seen the tunnel boring machines going south. They've broken through early, 2 months early, to the Bogger Road site. And the 2 much bigger tunnel boring machines that are going north will be, by the end of this year, into daylight on the exhibition line and having the tunnel job completed. So this project is going very well. It's going to transform how people move around Brisbane and southeast Queensland, because it's going to have benefits on every single train line. But of course, it's been a really important part of us getting the Gabba in the Paralympic Games too.
Have we got enough room for it all? Is it, so it's all mapped out, considering that 2032 will probably be a lot bigger. Is there more land or more things that you're trying to acquire, the government's trying to acquire? Or?
No, we've got all the land we require, and what we see there is fantastic renewal, urban renewal opportunities at each of the stations. So Here at the Gabba, it will be an entirely different kind of urban core where locals will enjoy it, but everyone coming to the AFL or the cricket or any of the concerts and gigs that will happen at the Gabba will enjoy it too. But equally, when you go into the city, the Albert Street station will be incredibly busy. For the first time ever, you'll have a railway station right in the heart of the CBD, so whether you're a QUT student, a public servant, work anywhere in that heart of the CBD, you'll be able to walk a block or two from the underground rail line to work. It'll transform how people travel.
Deputy Premier, sorry. Will a new chief health officer be appointed before Christmas?
I'm not across the details of the selection process.
Would you like that to be the case?
Oh, look, that's a matter for the panel. There's well-established processes for this kind of recruitment.
Does anybody have numbers on how many people are in home quarantine?
Yeah, it was 835.
Yeah,
right?
800.
About 800. About 835.
Thanks.
Thank you.
Very good.
Thank you.
Yeah, we might do that.
835.